Hello, my name's Nicola and I'm from the East Hertfordshire Family Centre Service. I'm going to talk to you today about breastfeeding, looking at attachment and positioning and some different breastfeeding positions. So breastfeeding is a tough skill to get the hang of, and it takes time for yourself and baby to learn this skill. It's very common for breastfeeding to take some time. And most mums are wondering if they're doing it right or if their baby is feeding well, and that's especially true in the first few days after birth. It's really important that if you are struggling or concerned or worried or just have any questions around breastfeeding, that you ask for help, you speak to someone. There's lots of advice online, there's lots of helplines, there's lots of different places that you can go to get advice. But you can always contact your midwife, your health visitor, or come to the family centre service, and there'll be someone there to answer those questions. So some of the top tips for getting breastfeeding going well is to watch for your baby's feeding cues. So your baby will tell you when they're ready to feed, and we encourage responsive feeding, so you go by what your baby is wanting. It's really important to look for those early feeding cues. So you've got early cues, you've got mid cues, and you've got the late cues. And we don't want baby to get to late cues, because that means they are over hungry, they're very angry and upset, not quite ready for a feed, and you have to sort of start the whole process again. So those early cues could be baby just moving slightly, their head movement, their mouth moving a little bit, they're stretching a little bit in their cot or in their Moses basket. Then you would know, pick baby up, get yourself into the position and get yourself ready to feed. Those mid cues, baby's not quite too agitated, but is getting a little bit more hungry, is getting to the point and he's saying, you know, I'm ready now. So the noises may be slightly louder, the movements slightly more exaggerated, and they're moving their head slightly more. And then again, you would pick baby up, get ready, get in your position and get ready to feed. And then those late cues tends to be when baby is crying, very loud, very agitated, face may be going a bit red, just really ready for that feed. At that point, you would need to calm baby down before you would be able to have an effective feed. Skin to skin is a really good way of calming baby down at this point, and it can really help with increasing and maintaining your milk supply. So skin to skin is very important during breastfeeding and any times with your baby, but again, it can really help with calming baby. Another top tip for feeding is trying not to give baby any other fluids during the first few weeks of establishing breastfeeding, and then up to 6 months afterwards. Trying not to use a dummy as well, especially in those early days before breastfeeding is established, and it can cause confusion for babies. And it's really important to remember that your nighttime feeds are sort of one of the most important ones for milk production. So all of your hormone levels are higher at night, and so baby will feed well and have a good feed, and then that will set you up for the rest of the day. So one of the key things to ensure when you are breastfeeding is that you get good positioning and effective attachment. So the positioning describes how you're sitting or lying when you're feeding your baby, and how you're supporting your baby during this feed. How you hold your baby makes a big difference to the feed, and it could be even the slightest little adjustment that makes that significant difference to a successful feed. The attachment describes how baby takes the breast and how well they attach on with their mouth to ensure an effective feed. So to look for good attachment and positioning when breastfeeding, I'll show you using the baby. You would hold your baby nice and close to you. So keep baby nice and close so there's no gaps between yourself and baby. Ensure that you are supporting baby's neck but not holding the back of baby's head, because you need to have baby being able to move, release themselves from the breast if need be, so with support. You can tuck an arm around the back, you can tuck an arm there because hands can get in the way. Ensure that baby is in line, so their head and their body and their feet are all in a nice straight line. If baby is twisting head round, they will not feed effectively. And when you bring baby to breast, ensure that their nose is to the nipple so that they can then tilt their head back. You want to look for a nice wide open mouth, and when your baby's mouth is wide open, their chin, it will be tucked into the breast, and you can bring them up and onto the nipple. When baby is attached onto the feed, you'll notice that their cheeks will be nice and round, not sucked in, and they will have a full amount of breast. They won't just be sitting on the nipple, they will have a nice round cheeks, which shows that they've got a good attachment. A really useful acronym to remember is CHINS, and CHIN stands for holding baby close, as we said. The H stands for the head, so ensuring that you have got good support on their neck but not the back of their head. That baby is in line, so the eye is in line, so everything is nice and straight so that baby can feed effectively. The N will stand for nipple. That means that you're bringing baby nose to nipple so that they will be able to get a good attachment. And ensure that the feed is sustainable so that you are comfortable, that baby is comfortable, and that you can keep that position through the whole feed. So CHINS, close, head, in line, nipple, sustainable. So some of the things to look for to tell whether baby is feeding well and whether breastfeeds are going well is that, as we said before, baby has a large mouthful of breast, so nice round cheeks. If the cheeks are sucking in, it means that they're possibly not attached very well. You want to see that their chin is firmly tucked into the breast and it's not loose and free. Their head needs to be chin needs to be tucked in. It shouldn't hurt. It may feel a bit uncomfortable and a bit of a strange sensation when the sucks first start, but there shouldn't be any pain. If there is pain, then the attachment needs to be looked at. You should be able to see more of the darker skin around the nipple above the baby's top lip rather than below the bottom lip. Your baby's cheeks will stay rounded during all of the feed. Baby is rhythmically taking long sucks and swallows. It is normal for baby to pause during a feed, but those sucks and swallows you should be able to notice. When the feed is finished, your baby will come off on their own because they have had enough to eat. They will feed between 8 to 12 times in 24 hours, so you want to make sure that you're having those nice regular feeds. The weight gain after 2 weeks of birth, you will notice that baby's weight should be going up, and you should have at least 6 wet nappies and 2 dirty nappies in 24 hours. The amount of poo varies from baby to baby, and most babies pass lots of stools, and that's a good sign. That's okay. Once the feed is finished, your breasts and your nipples should look the same as when they started the feed. They may feel less full, but your nipple shouldn't have changed shape. It should all look the same as it did, and your baby's content and satisfied, and that's a really good sign to know that the feed has gone well, that in between those feeds baby is pretty content and satisfied. If any of those aren't happening, then it's really important to speak to someone about that. So I'm going to contact your health visitor or midwife or the family centre service. If any of those things are not happening, or you're worried about the feeding, or you are possibly thinking that maybe there is something else in there, possibly a tongue tie or something like that, and that's something that a health professional needs to look at and to explain whether that's the case. So there are quite a few different breastfeeding positions where you can actually hold your baby. Lots to try, lots that you may find easy to do, some that you may find quite tricky. It's always important that when you are trying any of the positions, you ensure that you are comfortable before you start. Have everything you need by you, whether that be a drink, whether it be your phone, whatever it is you need to have near you. Have that there ready so that you are there to you can sustain the feed all the way through. Some of the most common used positions include a cradle position, cross cradle position, the clutch or the rugby ball, and side lying. So we'll have a look at some of those now. Cradle position is probably the most common breastfeeding position. It's obviously the most common way that we hold a baby in a cradle position. So you would take baby and you would hold like this with your baby's head supported, tucked in. This is a really good position once you're established breastfeeding, and it's quite comfortable, but it can be uncomfortable if you have had a cesarean section because there's quite a lot of pressure on the stomach, so it might be worth having a little play around with that. You have got the arm supporting the back of the baby's neck, but there's nothing holding the head, and your other hand is free if you need to move baby at all or grab a drink or anything like that. You've got your hand free for that. The other position is the cross cradle position, so baby is still in the same, but you're using the opposite arm to the cradle position, so you would support baby with your arm that way. Again, it means that you have got another arm free. In this position you've got a bit more guidance to bring baby to the breast because you have your hand rather than just your arm. The clutch or rugby ball position means that you are holding baby to the side. Sometimes you need to make sure that you have no cushions or anything by you because that can be quite restrictive. Your baby is then tucked in and you have your hands on the back of the neck and you are able to then bring baby to the breast that way. This position is a really good position for if you've had a cesarean section because, as you can see, there is no pressure on the stomach at all. And that's quite a good position. It can be quite tricky to get the hang of because you have to make sure that you're in the right position on your sofa, or bed or chair, and that can be quite a good position if you are laying on the bed because you have got more room. And then the last one is the sideline position, and that is simply where you are laying on your side, whether it be on the bed, on the sofa, or if you're comfortable on the floor, that's absolutely fine. You can have a pillow to support your back so that you're not rolling about, and then you lay baby next to you, and where you are, bring baby again in the position, bring them close. This is a really good position for cesarean section as well. As you are laying, there's no pressure again. You've got to ensure that baby's nose is to nipple through all of these positions. Ensure that you remember the chin acronym and that you're holding baby nice and close and that they are in line. It's all of those things, but they're just different positions that you may find useful. As I mentioned before, there's lots of support and advice out there for breastfeeding mothers. You have the National Breastfeeding Helpline and the Association of Breastfeeding Mothers, which you can contact directly by phone. You have got support from the Breastfeeding Network, the NCT, which is the National Childbirth Trust, and you can also go onto the UNICEF website. There's lots of information online for those. Obviously, you have your health visiting team that you can contact, the midwife team if you're still under the midwife, and you can contact the family centre service who have lots of qualified staff to help with breastfeeding support as well. One of the other things to mention is smoking during pregnancy and beyond. Protecting your baby from smoke is one of the best things that you can do, giving your child a healthy start in life. Whilst it is difficult to stop smoking, it's never too late to quit. And so every cigarette you're smoking contains over 4,000 chemicals, and so smoking can significantly harm your unborn baby and obviously your baby once they're born. Cigarettes do restrict essential oxygen supply to your baby, and this can result in the heart having to work a lot harder and can cause quite a lot of complications during pregnancy and labour. Secondhand or passive smoke is also quite really harmful to baby. If your partner or anyone close to you is smoking whilst you're pregnant, it's really important to try and encourage them to give up and quit. But also, if you smoke and someone else is smoking near you, that makes it harder for yourself to quit. It's always important to ask for help and to chat to health professionals about that. There's lots of information out there. Secondhand smoke can reduce your baby's birth weight and can cause an increase in the risk of sudden infant death syndrome. Babies whose parents smoke are more likely to be admitted to hospital for breathing issues such as bronchitis or pneumonia during their first year of life. So obviously that's the risks of that, but the benefits of stopping smoking is that both you and your baby will immediately feel the benefit of it the sooner you stop. The harmful gases such as carbon monoxide and other damaging chemicals will clear from your body, which then in turn will clear from your baby's body. Stopping smoking can reduce the risk of complications during pregnancy and labour, and it can reduce the risk of stillbirth also. Your baby will be less likely to be born premature, and their birth weight will be slightly larger. Babies of smokers are on average 200 grams, which is around 8 ounces lighter than other babies, and that can be quite complicated during labour. And stopping smoking now can help baby in later life, as children of smokers tend to develop asthma and other breathing problems and may end up needing serious hospital treatment because of this. So the sooner you can stop smoking, the better. But even if you stop a little bit later on during the pregnancy, any time is beneficial to both yourself and baby. There's lots of support out there. You can contact the NHS Stop Smoking helpline, the Smoke Free helpline, which will give you advice and tips. Speak to your midwife and speak to your health visitor also, and they can help you with those things.